Hello, I'm Dr. Dennis McKenna. As always, I'm joined by Dr. Fred Venditti, our hospital system general director. Today is Thursday, February 18th, giving you the update from Albany Med. Fred, I was going to say, if people only knew what we talked about before we came on the air, it would
Well,
be...
they're going to hear some
They're
of
going to
it.
hear some of it.
They're going to hear some of it, so stay tuned.
Stay tuned. All right, Capital Region, the 8 counties. Currently, we have 214 in hospitals diagnosed with COVID. High water mark was 553. We continue to see that come down. 2 points, Fred. I saw some graphs today. If you look across the state, virtually every region is seeing the same thing. Very steep drop-offs, except for New York City.
Yes.
Population density, or what's the theory?
Perhaps, Dennis. They didn't actually go up as much as all the rest of us, so that's probably a factor as well.
And I think their peak actually came a little bit later than our
It
peak
did
as well.
Yes, it did.
Okay, admissions and discharges here on this campus only, Albany Medical Center. Again, good news, over the last couple days, single digits.
Yes.
Single digits. So, and that brings us to the last graph, which is the morning census here at the medical center. Fred, we currently have 74 in-house, 13 in the ICU, 7 on vents. This is my second question. Of those 74, we talk about this probably at least once a week, every other week. What is the number that are no longer infectious?
I think Dennis today was 24.
24.
So about a third of them.
About a third of them. Okay.
And that's come down from a high water mark of 49.
49. All right, but very good.
Making progress there.
Fred, we've talked about our N95 masks. These are the respirators that we use for airborne particles to try to prevent transmission.
That's right, Dennis.
We had the teal masks, a significant number of those that were recalled. Fred, let me start with this question again. The teal masks, are there places in the hospital that can only use the teal masks?
Yes, Dennis. So they are splash resistant. So the operating room and labor and delivery are places where you need to have splash resistant masks. So that's important for them to be used there.
So we would be correct in saying that, if we have a number of teal masks, we want to preserve those for that location, which can only use those.
That's right, Dennis. And so as of today, the teal masks are going to be restricted to those areas where we need them. And there are a few people who aren't able to wear the white or the duckbill masks, and so they'll be specially available to those people as well.
Some people might have seen the 60 Minutes episode that was talking about the issue with the N95 masks and the respirators and the issues that are happening. So it's not just on this campus or even in the state, it's national.
Dennis, I think there were 16 million recalled
right.
Across the country.
Right. So therefore, if you are somebody who has worn historically the teal mask and you have not been fit tested for the white, obviously we're asking people to get down there and get that done. And I know myself, I got fit tested for the white because of my birth month, and it's part of our annual health assessment. Some people may not have had that opportunity yet. So the time is coming to get tested again.
That's right. So tomorrow and Monday from 7 to noon, and then again from 1 to 5 down in the cafeteria in Choices. And then on Saturday from 7 to noon also down in Choices. We'll be doing fit testing. You can sign up through Elsevier if you want a specific time, or you can just go. If you haven't been tested, go.
And we want to thank Kenny Urquhart and his team. They've been putting in a lot of hours to be sure that we have every opportunity for our workforce to get tested. This is very important.
It is. It is. We want you to be safe. We want our patients to be safe. And fit testing is an important part of this, so you wear the right mask.
So specifically, if you are somebody who works on a unit where historically you've gone and grabbed a teal mask, starting tomorrow,
they won't be there.
You'll have to use a white mask.
That's right.
So if you're not fit tested, you need to get fit tested.
That's right.
All right, very good. For those who have watched these videos, Fred, we know that there's a particular sense that is affected by COVID.
That's right.
And that sense is smell.
Smell.
And you want to give us an update on that.
That's right, Dennis. So smell is affected by COVID in upwards of 70% of people who develop COVID. And interestingly enough, a good proportion of them, about 10%, it's very delayed in terms of coming back. Right. And as you know, smell is very important to detecting flavors of food and other things. Flavors are a combination of smell and taste. Right. And taste is restricted to just a few things, right?
Right. You want to guess?
Yeah, do you know what they are?
Bitter, sour, salty, sweet, and I forget what the other one is.
Savory.
Oh, savory.
Savory,
Yes, I didn't
the
know
most
that one.
recent. The most recent. Think a steak, a stew, that
Yep.
kind of flavor. So it's interesting. There's been some research on how COVID affects smell. It doesn't actually affect the nerves that detect smell. It's the cells around them. And they know that because the nerves don't have ACE receptors.
We've talked about that.
Right, that's how the virus gets in. So those epithelial cells that help the neurons detect smell are the problem. And they regenerate over a period of time, sometimes longer than we might like. Interestingly enough, when your smell comes back, you can have something called dysnomia.
Dysnomia.
And what that means, smells smell different to you.
Right.
So something that smelled good might smell bad.
Right.
And it takes a little time for that to go away and your smell to get back to normal.
Is this an article that you read? Can we put it out on that site?
So actually, it's interesting. So there is an article in one of the journals that has compiled all the literature about the statistics.
Right.
But actually, a lot of this comes from the Boston Globe magazine from 2 weekends ago, where there's a very long, detailed article about this. It's really kind of fascinating. I would encourage you to go look at it.
I know you read that every Sunday.
Yes, I do.
So let's end on what I think are two really good news stories. We'll start with the first one. Every year around the holiday season, there's two events that are done specifically to raise money for the Melodies program here at Albany Medical Center, which treats childhood cancer. So the first one is Dancing in the Woods, which happens every year and is an incredible event and helps raise money. And the other one is the Melodies at Christmas.
That's right.
And there's a couple important sponsors who usually do that. It's Price Chopper, it's Freihofer's.
And Channel 6.
And Channel 6.
Yes.
So this year, obviously, because of COVID, it was difficult to do both of those events. And so our foundation worked with both of those organizations and tried to say, can we still raise the money? And they were very successful.
That's right. So we sort of did it virtually, if you will.
Right. A couple of board members, I think, led the effort here on this campus. So Jim Barba.
Lisa Mosier.
Yes.
And John Nigra.
Yes.
Thank you very much for your efforts.
And our goal really was to raise $500,000, but incredibly, they exceeded the goal.
They actually raised $632,000.
Right.
Just an incredible number.
And that money is important because the program it supports, the Melodies program here, really what it does is it makes sure that if you're one of the 200 or so children in the capital region that are diagnosed with cancer every year, that you can get world-class treatment right here.
Right here.
You don't have to go to Boston. You don't have to go to Philadelphia. You don't have to go to New York. So the money goes right into that program. And so to everybody who was there, including a significant part of our community, we thank you.
Thank you very much.
Yeah, very good. And then another good news story is what happened yesterday. So we were reminded yesterday by Sandy Castilla that yesterday was Random Act of Kindness Day.
Yes.
Which is a good segue into the story. Back in the early part of the pandemic, when things such as face shield and goggles were difficult to get, we got a phone call from the Center for Disability Services, whose president and CEO is Greg Sorrentino, as well as Maureen O'Brien, who's president of NYSID. And they said that they have an incubator, and they have the ability to 3D print face shields for us. And so, is that something that we would use? And you can remember, Fred, they came and they delivered hundreds of those to us.
We actually wore them on one of our videos back then to demonstrate them.
We did. And I actually wore it in the emergency department. And so fast forward to yesterday, we were able to go down to the Center for Disability Services, and we were able to participate in a press event where vaccine had been redistributed in the capital region to the population that they serve. The IDD populations for individuals with developmental disabilities. And so we were there while this population was getting their vaccine. And Fred, we've been in situations where the vaccine clinics occur. They're always really uplifting and positive.
Yes, very much so.
And they were yesterday as well. And as Matt was telling us, it really is an opportunity to show our community at its best.
That's right.
Right. So it was a fun
Helping
event.
a vulnerable population really felt good.
Absolutely. So again, I mentioned two individuals before who were part of that. Ruth Leslie is our planning lead for the Capital Region Vaccine Network, made that all happen. It was a great event. And obviously, they'll get their second vaccine in the future. And there'll be other times to do that. I think next week they have another one as well. It was just a great event. And I wanted to share that story. So that'll be it. And what's going on this weekend? I guess obviously the medical center is preparing for a possible snowstorm tomorrow.
Snowstorm this afternoon through Friday, yeah.
And that's important because vaccine, which was supposed to be delivered to the region, actually appears to be delayed. So if you're somebody who was planning on getting your vaccine this week, obviously all entities, hospitals, county health departments, pharmacies will be working to get those rescheduled when the vaccine comes in next week. Obviously, our facilities folks here will be doing everything they can to keep the doors open so we can continue with our very important
As they
missions.
always do, and they do a great job.
They do as well. All right, so that's it. So we'll be back again next Tuesday with an update. All right, very good. Thank you very much. We ask that you once again, please take care of yourself, take care of each other, and we'll see you next week.